Hello and thank you for joining me. Today, we're going to walk through a new system, one that's designed to help some of the most vulnerable people get the support they need. It's all about rethinking that very first, crucial step someone takes when they're in crisis. So, let's dive right in. So, here's how we'll break it down. We'll start by looking at a huge problem we call the silent wall. Then I'll introduce our solution, a safer first step, and we'll actually walk through what that looks like from a survivor's perspective. After that, we'll talk about something just as important, protecting the people who provide support. And we'll wrap up with where the project is now and how you can get involved. Okay, so first things first, let's talk about the real human problem that's at the heart of all this. It's a barrier, one you can't see, but for so many people, it feels absolutely impossible to get past. This quote, it just gets right to the point, doesn't it? It's the whole reason this project exists. When someone is really truly in distress, it's not figuring out the solution that's the hardest part. It's just asking for help in the first place. That's often the biggest hurdle of all.
Think about it. Feelings like shame or fear or just being completely overwhelmed, they all build up, and they create what we've started calling a silent wall. This is especially true for survivors of violence, for refugees, really for anyone going through intense trauma. This wall is what stops them from making that first, absolutely critical contact to get the help they need.
And honestly, this is where so many of our traditional support systems, well, they just fail. They're built on this one big assumption, that a person in crisis can just pick up a phone and explain what they need to a total stranger. But for so many people who are at risk, that's just not possible. That single assumption becomes the first point of failure, shutting them out before they even get a chance to start.
So, to break down that silent wall, we had to come up with a totally different way of thinking. We needed a system that wasn't built on assumptions, but on empathy, on truly understanding what a person is going through in that moment.
And when you put the two side by side, the difference is just night and day. The old way forces you into this immediate high-pressure phone call, maybe when you're not in a safe place or you're around other people. The new way, it's completely silent, it's private, you can move at your own pace, you don't have to talk to anyone. You pick your language right at the beginning, it just removes all those barriers in one go. Now, I want to be really clear about something. This is not about replacing human support workers. Not at all. Think of it more like building a better, safer bridge to that human support. The whole point is to create an intake process that gives power back to the individual, through anonymity and control at the very moment they feel most powerless.
Okay, so now I want to shift gears. Let's try to experience this system from the perspective of someone who actually needs it. I want you to try and put yourself in their shoes for a moment, just so you can really understand what this journey feels like.
So imagine, you desperately need help, but the thought of picking up a phone and talking to someone, it's just too much. It's overwhelming. Maybe you feel ashamed or scared. You just need a way to reach out that doesn't involve your voice.
So here's what happens. You open a simple chat window. It's completely anonymous. The first thing you do is pick your language. Then, the system just asks a few gentle, non-invasive questions. And based on how you answer, you instantly see a list of available times with the right kind of specialist. That's it. No pressure, no waiting on hold, no judgment. And this right here, this is the real heart of it. In a moment where you feel like you have absolutely no power, the system gives you a little piece of it back. It's small, but it's so significant. Because you get to decide when you'll talk. You decide how, and you see who you'll be speaking with. You are in control. But that's really only half the story, because a support system isn't just one person, it's a whole ecosystem. And we realized that to make this truly work, to make it sustainable, we couldn't just focus on the person asking for help. We had to ask ourselves, what about the person on the other end of the line? What about the support workers, the therapists, the people answering those crisis calls? The old way of doing things doesn't just put up barriers for people in crisis. It puts an incredible, crushing burden on the staff too. I mean, these professionals are on the front lines every single day. They often end up acting like a human shield, just absorbing so much aggression, verbal abuse, and the sheer weight of trauma from call after call. And that kind of constant exposure, it's relentless. It leads straight to exhaustion, to compassion fatigue, and to really, really high rates of burnout. So we designed this system to act as a kind of digital buffer. It takes care of all that routine, often really stressful front-end work. It filters out that initial friction and stress.
And what that does is it saves the professional's emotional energy, which is not an infinite resource, for what really matters, the actual one-on-one, high-value interaction with the person they're there to help.
And this is just fundamental to our design philosophy. We don't just protect the client. We have to protect the protectors. You can't have a healthy, resilient support system if you don't take care of the caregivers. So by making this first step less draining, we're helping to build a much more sustainable environment for absolutely everyone.
All right, so let's move on to the final piece, where this project is today and where we're headed next.
On the back end, this thing is built to be a workhorse for organizations. It has intelligent triage so it can automatically flag urgent cases. It matches people with the right specialists based on their calendar and skills. All the booking is automatic, and, crucially, it generates the anonymized data that NGOs need for their reporting and for securing their funding.
So where are we right now? We're currently in a closed alpha test. We're working very closely with a nonprofit organization in Europe, and we're using their real-world feedback to refine and improve the system every day.
And one last thing that's really important to us. This is a mission-driven project through and through. We're developing this completely pro bono. Our only goal is to contribute a truly useful and scalable tool to the humanitarian community.
So, I'll leave you with a question to think about. If these ideas, the silent wall for clients, the burnout for your staff, if those things sound familiar, I want you to ask yourself, how could a safer first step really transform the work that your organization does? We truly believe this is just the beginning, and we'd love for you to connect with us to explore what's possible. Thank you so much for your time.